Hello everybody, how are you guys? Hola a todos. Oggi, Fragenci. Vamos a hablar en inglés, español, portugués, porque hoy tenemos un día fantástico. Vamos a invitar a la doctora que viene ganando. Todavía no lo vamos a cerrar al challenge. Mira, acá estamos rodeados de cirujanas y cirujanos por aquí. Entonces vamos a invitar a la doctora que viene ganando el challenge. We're gonna invite the doctor who is winning the challenge, okay, to tell us a little bit more. Let me see. So she can tell us her secrets. Así nos puede contar sus secretos, que es la que se encarga un poco de su formación. Ahí está. So we're gonna talk English, Portuguese and Spanish. Camila,
Olá,
¿cómo va?
tudo bem?
Okay, well, we're gonna try to talk in English, Spanish,
Então,
some Portuguese. Bruna,
Hola, hi. How are
we're
you?
so happy. We're so happy here. We're surrounded by female surgeons, as it should
We're
be.
dominating the
As it
cataract
should be. Tell me if
scenario.
it's not. And well, we're gonna tell an amazing story here because we have been doing what we call the Evo Challenge for the past, I don't know, 3 or 4 months, and we have an unbeatable surgeon, and we want to learn more from her. For the people who don't know, I'm gonna switch my cameras. Give me 1 second. There you go. And we're gonna talk a little bit about what the Evo Challenge means. Okay, so what we have first is a virtual simulator, as you can see there. It's called the IC simulator, and there is a challenge in which you have 20 minutes to perform. And guess what? The most complicated and most difficult task you can find in the challenge. Okay, you have a very difficult capsulorhexis, hydromaneuver, a lens removal, which is almost impossible because of the weakness, irrigation aspiration, toric IOL, and anterior vitrectomy. So we're gonna tell this story, and we wanna know your secrets, Camila. So please, because I want you guys to see carefully of her metrics, and we have the full video. So she couldn't do the tasks, individually and then put them together. No, she has a full video. From the 20 minutes, listen to this one. She got a 6 minutes and 27 seconds left. So she was fast, I can tell you that. And look about, the use time in each task, and especially in this task that is almost impossible. We have never seen anybody around the world getting more than an 83, and the rest is 100. So look, we have all the team here, most female surgeons. So tell us some of your secrets, Camila.
actually, I don't have any secrets. Here at the Altino Ventura Foundation, we start using the IC cataract surgery, the simulator on the first year of residency. So I learned here to don't give up on the bad days because we all have bad days.
Nice.
Um,
Nice.
and I really learned to enjoy the process. My first challenges were not that good, but I
Okay.
kept doing it every day, and then I just
Okay,
got better.
that's something I like, because again, for people who don't know a little about you, you are still in second year of residency, or you're going to
Third
third.
year right now.
But you started like
Yeah.
very
Yes.
soon. The second thing is you're telling us something that I think is so powerful, but it's not intuitive. Is that you practiced? You practice a lot in order to get this score, right? And
Yes.
guess what? You practice in a simulated environment in which every
Actually, the
mistake.
first time I tried these challenges, this challenge was with you and in Brascars.
Oh, in Brascars, in
Yeah.
Rio de
Yeah.
Janeiro. Okay.
Yes. It was the first time I tried, but my score was not that good. So when we got here, we kept trying not the new one, because we just got the actualization right now. In April, no, in February, I think, maybe February or January. But I kept practicing all the different skills and try to do the surgery completely.
Okay. Very interesting. Bruna, tell us a little bit more about about Camila, about what you're doing in Fab. I think this is completely amazing. Think about it. She has a score that we have been all around the world. We have people all around the world trying to do it, and nobody did it as well as her.
Yes, well, I think something that Camila said that's very true is training. So the simulator and all the different artificial eyes are very, very helpful for us to get even better. So enhance what we do already. It was interesting for her to say that the first time she did it, she didn't get a good score. And now she, well, from what you say, she has like one of the top scores in the world. And that required training and that required perseverance and all of that. Here in the Altino Ventura Foundation, we truly believe in practicing and enhancing our surgical skills through practice. So now we continue having the IC simulator, as Camila said. And since our first year residents, they all have time in the simulator throughout their 3 years here. But we also have three artificial eyes that are made in Brazil, that are Brazilian eyes, and that we have recently had them commercialized, which is wonderful. Last year we got two of them. This year we just got the third one, and all mainly with the main objective of enhancing surgical performance, bringing more confidence for the residents during surgery, bringing more less complications for the patient, so being more secure, the surgery having less complications and being safer for the patient. That's our main outcomes.
So people can understand a little bit more, Bruna. How many residents do you have now in Fab?
So we have 16 residents per year in average. So 16 first years, 16 second years, 16 third years, and our fellows. That's an
Yeah,
average.
and I'm pretty sure that if there is somebody who can know the impact of the simulator in the surgical times, surgical
Hmm.
complications, you tell us a little bit more about that.
We, I always, I always say that the foundation as an institution, as a training institution, we saw what was training, surgical training before the simulator, that was before 2019, and after the surgical simulator. So everyone that goes to surgery without doing training in the simulator in artificial eyes, you have to learn each step. So you don't sit down in your first surgery and you can already do your first rexes. You start slowly and through many eyes, many patients with a lot of like staff orienting and guiding you. Once we had the simulator, it was amazing how easy it was for the residents. I'm sure Camila can say, like she sat and she knew how was the movement to perform the rexes. It wasn't something that she had to learn from zero. She was already familiarized with the movement, with how to deal with complications, how to adjust the different steps of surgery. So it makes everything so much easier when you go to the real world and to the patient. And my dad always say how it makes us learn without having the hard parts of learning. Of course, you have good days and bad days, like Camila said, but at the same time, you're better trained. You go better prepared for surgery for
And
sure.
one thing I
Amazing. So we are
also
showing.
noticed
Yes, please.
One thing I also notice is when we want to change something on our surgery, like the place where we can start the rexes, I can get to the simulator first, do it in the simulator, and then start doing a different way than from I was doing before. It's safer to do it like this.
Yeah, we have your video right here. You know, one of the things about the challenge is, again, we're going to tell a little bit more about the rules about the challenge, because we want people from all over the world to do it and to tell us, what they're doing, what they're thinking. And now, for example, the doctor right here is doing, which I consider one of the most difficult steps, which is, let me tell you this, guys, this is like an impossible step. You can see the sonular dialysis. It's sonular weakness. It's a small rhexis. It's hard cataract. The capsule is weak itself, and the entire rest of the sonula is also weak. And again, you can find so many, like even master surgeons, that the first time they're going to face this case, they're going to drop the nucleus, right? Because then you need to adapt what's going on. How do I face this case? Which technique I'm going to use? So, Camila, I think you said something I loved. You said we all have good days and bad days, and so you were in a process of learning. Tell us a little bit more about that process. How you were making decisions. Because, for example, here that I did the challenge, sometimes it's easy to train a student and say, "Oh, you should do this, you should do that." But how was that process for you?
Um, Actually, I was always a person that liked to do like to manipulate small stuff. So I wasn't that bad at the beginning, but sure, I was not what I am today. So doing it every day and learning that not every day was going to be good. Some days I just go there and try some challenges, and I know when I'm missing it, I know that it's not my bad day, and then I ask to stop and then come back another day to try again, because sometimes you're just tired and you have to respect that and not give up, because sometimes, especially when we are residents, we have surgery complications, and if we give up, we will never get better.
Very nice. I love this, and we have many things, here at the campus. You're gonna see many things. You're gonna see even animals, and there's a why we have a gorilla and and a crab and all the stuff. But one of the things that we talk a lot about is, I think, what you're describing here, because I'm taking notes about what you're saying, right? I'm gonna put here resilience. That is one of my favorite words, because it's exactly that. It's about transforming failure into learning. Okay, but then I'm gonna ask this question, especially to you, Bruna, because we didn't, at least I didn't have a chance to have a simulator during my training, so it wasn't easy for me to say, "Oh, I'm gonna have resilience. I had this big complication on a patient, and I'm gonna learn from it." Actually, it was the opposite. My confidence will drop, and I will have a very hard time, and I will feel very empathetic and sad for the patient. So, what's your opinion about simulation in surgical, not only training, but improving as a surgeon during your entire life?
Yeah, no, it's essential. I think it was interesting because 2 years ago, I think you put together like challenge in one. I think it was the Pan American meeting or something, and we were supposed to sit at the simulator and we were going to compete at the simulator. And it was interesting because I sat at the simulator to do some of the steps. And when you sit at the simulator, you see how you can improve all of the steps of surgery. It's amazing. And what I love about it is that you can repeat over and over that same step if you're having a hard time. So it's very, very interesting that during our learning curve, we're sometimes so good at everything, and then we're like, oh my gosh, I forgot how to do hydrodissection, and then you kind of have a low in your curve, and then you're back again on track, and then you're like, oh, I'm having a hard time on my nucleus, or I'm having a hard time on my rhexis. So it's not a continuous learning curve, and it never comes down a bit. It most of the times you have up and downs. And the good thing of the simulator is that you can go over and over that step if that's your Achilles ankle. Like you can go over and over and get better and improve and try different scenarios. So how how are you going to use real world to train on challenging cases, let's say zonulopathy, and get good at that if you're operating only on patients? If you have simulator and you can spend 2 hours on it or an hour on it, just training that scenario, specific scenario, in- increasing the challenges, decreasing the challenges, and improving yourself, that makes your learning much faster and much more solid. That's what I feel like, how things become more intuitive once you tried it over and over again.
Perfect. So, for example, here right now we have one of the top scores here in Mexico. Ame, say hi to the camera.
Very good. Very good.
I
Congratulations.
put her to suffer again with the lens, okay? And just to finish, and thank you guys so much for your time. That I know you're very busy. I wanna again congratulate you, Bruna, for what you're doing in Fab. I think it's amazing. I think your entire country should be looking at what you're doing and improving that, because all your residents are having such a great experience and learning so much. And Camila, again, if you think about other uh, tips you will give to the people who are doing the challenge. We have people, I'm telling you, like from Europe, Asia, Africa, in the entire South America, three colleagues from the US that again struggling so much. So what do you think are the best tips in order to do it?
The cataract, doing it slowly, very very slowly. When you are separating the cataract, do it in 2 steps. Um, First, for the first time, and you don't open it until the end because you will damage the zonula. So you have to go down and open it again. Um, to
It's exactly what
to
Ame is doing here. I love this so much.
yeah.
Think about it, Bruna. Like after training so many people from so many years, one of the things I'm saying now is I love when people transform in the course and they start to respect the eye and be delicate. It's so impressive how you can, train somebody before they get to the operating room and they are delicate with the eye. They
Yes,
know
definitely.
how dangerous they can be. What do you think?
Yes, the maneuvers, although there is a difference, it's not that the simulator is exactly the same. It's simulation, but it's so real. It's so real. So it's really, you can totally extrapolate what you learn in the simulator to real life, and what you learned without stress, without sweating, without having a patient in front of you. That's, I think, the big pearl.
Perfect. So thank you so much for the time.
Thank
We're
you.
gonna keep you in touch, but I think Camila is gonna be one of the greats of this challenge, and I hope we can improve it and make it better. So thank you so much for your time,
Thank you.
and hope you're doing great in Brazil.
Wonderful. Count on us,
Goodbye,
Ivo. Thank you
Ferreira.
so
Thank
much
you.
for everything.
Okay,
Bye
guys.
bye.
Bye bye.